today. The doctors we have today are Dr. Albert Lau, Principal Medical and Health Officer of the CHP, and Dr. Sarah Ho, Chief Manager of the TMHK. Dr. Lau, please tell us about the cases update. Good afternoon, members of the public and media friends. And our report the cases recorded yesterday on the 19th of April concerning COVID-19. Yesterday, there were 330 cases confirmed through PCR tests, including 93 cases confirmed by the hospital authority. 64 were confirmed by the Public Services Laboratory. The remaining 173 cases were confirmed by private laboratories. And also, we recorded 338 cases yesterday confirmed through RAT. The total number recorded yesterday was 668. So far, in the fifth wave, Hong Kong has recorded 1,187,075 cases, including 743,569 cases confirmed through PCR tests and 443,506 cases confirmed through RAT. Among the cases confirmed yesterday, 13 were imported. The remaining 665 cases were locally infected. Among the imported cases, 9 were caught at the temporary specimen center at the airport. 3 cases came to Hong Kong on the 19th of April via flight PG600, 2 passengers from India and 1 passenger from Pakistan. On another flight, that is EK384, also arrived at Hong Kong on the 19th. There were 4 cases. 2 were from Thailand and 1 from Pakistan. The other one from the United Arab Emirates. The remaining 2 cases caught at the airports included 1 case from Indonesia and 1 from the Philippines. The other 4 imported cases were all identified and during hotel quarantine, including 3 cases confirmed on the 3rd, 4th, and the 5th day via RAT, and 1 was tested positive on PCR on the 5th day from Siberia, Malaysia, Korea, and Thailand. Yesterday, concerning the genome sequencing we have performed, there were 206 specimens. No L452R strains were found. 199 samples were tested negative for L452R strain. The remaining 7 samples were unconfirmed. Yesterday, and there were no new residential care homes experiencing new outbreaks. And there were 8 residential care homes for the elderly people or people with disability having reported infection, reported new cases yesterday, including 6 residents and 3 staff. And also, 3 residential care homes for people with disability reported infections, including 4 residents and 1 staff. For schools, this morning, through our online platform, 178 schools or 187 schools reported to us the condition of their students. All schools have reported this morning, including 41 on Hong Kong Island, 70 in Kowloon, and 76 in the New Territories. Classes were resumed for these schools. Among the 187 schools, most of them did not report positive cases except 3, including 2 schools in Kowloon and 1 on Hong Kong Island, involving a total of 4 students, 4 cases, including 1 staff and 3 students from 2 schools. They did not go to school this morning. And they did not visit the school recently. These cases were caught via the RAT, and they are not linked with schools, nor were they infected at schools. In terms of deaths, the latest number in the fifth wave is 8,973 mortality, an additional 10 compared with yesterday. So far, in the fifth wave, the mortality rate is 0.76%. For people aged above 80, fatality rate is 10.4%. The age ranges from 11 months to 112 years old. The median age is 86 years old. In terms of vaccination, 72.6% of the diseased patients did not receive a vaccination. 15.5% had one dose. Only 11.9% received two doses. Now, the mortality rate breakdown for those who did not receive vaccination, the mortality rate is 3.02%. After vaccination, the mortality rate would plunge. For those receiving 1, 2, and 3 doses, the mortality rates are 1.01%, 0.16%, and 0.04%. Those who have received 3 doses compared with those not receiving any vaccination, the difference is 76 times. For elderly people above 80, those without vaccination, the mortality rate is as high as 16.43%. Those received 1, 2, and 3 doses, the mortality rates are 6.95%, 3.74%, and 1.04%. Those with 3 doses compared with those without any dose, the difference is 16 times. That's all for my report. Thank you. Now, Dr. Ho, please tell us about the HA. Good afternoon. There are, at present, 2,829 patients receiving treatment at our public hospitals at North Lantau Infection Control Center, the CHP's Infection Control Center, and the AWE. Now, some explanation about the inpatient number. For the number we have announced in the past, it includes COVID-19 patients undergoing treatment, as well as patients recovered in convalescences in hospital, as well as patients with chronic diseases which are not related to COVID, as well as patients testing positive again. Now, having made reference to the standard, having made reference to the definition of patients died with COVID, we have updated our criteria so as to offer better treatments to COVID-19 patients, as well as redeploying manpower to take care of COVID patients. Starting from today, the HA will report inpatient numbers of COVID with regard to the new criteria. COVID-19 patients after 28 days after infection, they would be deemed as having recovered. Even if they have to stay in hospitals or admitted to hospital again because of other reasons, they would be counted as a recovered patient. As a result, you can see the obvious difference between today's number and yesterday's number. We have reported 3 critical patients, 7 serious patients, and 44 patients undergoing treatment in ICU. As at 0 hours today, in the past 24 hours, 10 COVID-positive patients passed away, including 6 males and 4 females, aged between 57 and 100. 3 patients were from care homes, 4 did not get vaccinated, 2 got 1 dose, 3 got 2 doses, and 1 got 3 doses. 9 patients were above the age of 65. There was a younger patient.
A 57-year-old female and she had terminal cancer, undergoing some palliative treatment, and she belonged to a high-risk category, but she passed away. 137 patients have recovered and been discharged. 7 were picked up as COVID positive upon admission screening. 12 patients are listed as close contacts. We have 21,960 staff members who have been infected. 21,028 are back to their posts. And I'll throw the floor open for questions. Please identify the organization you represent. TVB. 3 questions, if I may. First off, the government said that the recovered patients who have not declared themselves can do so by telephone or online and get the QR code. How many have made the applications? Do they have to submit further information? What sort of information did they have to submit to ascertain their COVID status? And second, if the recovered patient has not kept the RAT test record, would the government regard them as recovered patients? And will they be allowed to undergo an antibody test? Third, when recovered patients are making the declaration only now, will there be any legal liability, any legal action to be taken against them? Thank you very much for your question. In our declaration system, there are 2 types of cases. The first one is the PCR positive cases. Now, for these cases, the laboratories would submit the cases to us. Now, these are the qualified laboratories or the HA laboratories or the public health laboratories. So we are having record on these cases. The second type is RAT positive cases, which were done at home by the patients. If they test positive on RAT, they're encouraged to make the declaration in the self-declaration portal, accompanied by their record and also ID card. And they should make the declaration either today or tomorrow. Now, we did allow grace period if they tested positive after 26th of February. And before the portal was available, they could submit the details retrospectively. I understand that some people cannot make the declaration the following day. Now, if they see the need, we do have the email address for people to submit their information together with the ID record and also the positive record, and we would investigate why they failed to make the submission successfully, whether it was some technical reason or not. Through these emails, we have received a lot of emails coming in. We would look at the cases on a case-by-case basis. If they can advance a valid reason, we would so record the information in the system and count them as positive patient. So this email didn't come about yesterday. Since the inception of the portal, we have been receiving emails that they came in with these issues, and we would look at these cases. If for some reason someone has not made the declaration and they've lost all the photos, they should explain to us when they tested positive, and we would look at the cases on a case-by-case basis to see whether they are credible and whether they will be counted as COVID positive. Your last question? Speaker not speaking through. Right, for the RAT test, It is a self-administered test, and if they test positive and fail to make the declaration, we would not know about that. If they fail to make the declaration on the platform, they can email in with all the information. And if we find these to be credible, we would produce all the relevant documentation. Next question, please. Lady in the middle, please.
Hi, this is from the CMP. We would like to ask a few questions. Firstly, about the recovery record QR code. Dr. Choi mentioned yesterday that the system has over 1.18 million COVID patients record, but currently the number of COVID patients in the fifth wave is over 1.19 million. So we would like to know when will the department finish processing all their records so that patients can obtain their recovery record QR code. And we would like to know that there are some recovered patients mentioned that they could not register the QR code, and they tried to call the hotline, but the voicemail box was full, or they had to call over 2 hours to get someone on the phone. Are there any other ways that they can seek help from the department? And how long does the department take to reply them? Would the department take the initiative to reach out to the rest of the recovered patients? Besides, we would like to know, we can see that there is a rise of cases after the long weekend. There is a slight increase. Do you think that it is a situation to be worried about? Why or why not? How would you foresee the future trend? Thank you.
Thank you for your question. For the first question on the recovery QR code, as mentioned yesterday, the government has launched this recovery code, so people they can either go to the website to get the recovery code either through the IM Smart or the eHealth mobile application, or going to the COVID-19 electronic vaccination and testing record system. They need to input their name and also the Hong Kong identity card number, and also the day of issue of the identity card number, so that they can obtain the QR code. The CHP has updated the database. So far we have recorded over 118 million cases. So these cases, if they are recorded in our system, then we will update the system so that the relevant electronic the systems can recognize that an individual is a recovered case, so that they can obtain their recovery QR code. We understand that some patients or some people they could not successfully obtain the QR code. There are several reasons for that. First of all, it might be due to the fact that their record is not in our system, and secondly, they might have not reported their RAT positive results to us, so that they are not recognized as a confirmed case in our system. So if people they have problems, if they have been tested positive, but they have problems in getting the recovery QR code, they can either dial our hotline 2569-5777, so that we can assess the situation and see if we can help them, or they can also send an email to us. We noticed that there are quite many people are using this hotline, so we are increasing our manpower so that we can handle the inquiries within a short time. For the third question on the epidemic situations, in the past few days, there were about 600 to 700 cases per day in Hong Kong, which is at a stable level. But however, as compared with the past, this level of cases is still at a high level. So people need to continue to the precautions and also maintain social distancing measures. So far we do not see an obvious trend of upsurge, but we will closely monitor, because the Easter holiday has just ended. So we need to observe for a few days or even a week to see if there is any possibility of upsurge.
Next question, please. Let's take another English question.
Thank you, doctors. I'm from Bloomberg News. Is there data available on the number of people that are currently staying in community isolation centres, as well as what is the current capacity of the community isolation facilities? For example, the number of rooms or the number of beds? Thank you.
The government has adopted the multi tiers of triage for in our isolation policy. So there are 5 layers. People with significant symptoms of or severe disease will be admitted to hospitals or community treatment facilities, and people with mild symptoms or asymptomatic, they would be isolated in community isolation facilities if their home environment is not suitable or if they are high risk belongs to the high risk group. And if in general, if people they are not belong to the high risk group or their home environment is suitable for isolation, then they can be put under home isolations. Currently, there are over 50,000 capacities in various community isolation facilities. So that's enough for the current situation in Hong Kong. But I do not have the exact number of people put under isolation in CIF at the moment. Maybe if Dr. Ho has any figures.
Sorry, I don't have any supplement.
下一題。
Next question, the gentleman at the back. Hong Kong 01, several questions for the doctors. Now about the QR code for recovered patients. You said it was mentioned that some recovered patients did not receive the QR code. You said you are currently updating the system. Is it because the database is being updated, that's why a QR code is not sent for some patients? And why didn't you update the database in one go before launching the platform and cause the problem? Some patients were confirmed in March and they got the QR code, but some patients confirmed the disease before that and did not get the code. So what is the priority, and when will the problem be solved? And yesterday, an international school has got 13 patients confirmed. Which school is that? Among the new cases today, do we have cases from this international school? You said they didn't go to school. After investigation, if it is found that there were contacts between the patients, would you ask for a suspension of school? The HA said there would be quotas set aside at designated clinics for students. So how many bookings are there at present from students? On your first question about recovered patients' QR code, like we said yesterday, through eHealth, I'm Smart, or the COVID-19, the government's COVID-19 vaccination and testing system, you have to submit your ID card number and the issuance date of the ID card, as well as your date of the sampling date to get a QR code. Now we are currently updating the database as we speak. So we will enter the data into the system continuously. And also the isolation order or quarantine order would come with a QR code for recovered patients. We are aware that there are some recovered patients who are yet to receive the QR code from the platform. It may due to the updating of data. We will speed up the process. Another possibility is that there is a discrepancy between the personal data on the system and the data submitted, for example, the ID card number. So the patients might have filled in the personal information from a community isolation center. Erroneous data would result in failure of QR code being sent. And also there are people who have failed to report their results in time. That's why we have set up a hotline for inquiries by recovered patients who are not able to receive, who are yet to receive a QR code. They can get help from the hotline. And also for patients who were confirmed before the 30th of June, documentation can be used in lieu of the QR code, including hospital admission record, paper-based record, as well as SMS text, and also quarantine isolation order issued by the Department of Health, COVID-19 record, as well as other documentation. We will keep the database updated. Concerning schools, there are 3 schools which have reported 4 cases. When we receive declaration from schools on the platform, we would investigate the situation, contact the schools and verify the data, and see whether further investigation is warranted. If clusters are found in a class, we will follow it up. Yesterday, a school reported 12 students tested positive through RAT. We immediately made inquiry with the school and asked about the distribution of the cases, and we were told which classes they are in. With the list, we can learn more information from the parents. Towards the evening, we were told by the school that the parents reported the positive cases erroneously. The students were in fact negative. There is an intranet with the school for parents to submit the RAT reports. After confirming with the parents, it was found that the students were tested negative. It was just that the parents made a mistake. So we are trying to find out the reason and confirm whether the 12 students are safe. Upon further confirmation this morning, it is confirmed that all 12 students are actually negative. We have 23 designated clinics. Every day, there are over 4,000 consultation quotas. Over half of the quotas are reserved for high-risk people, covering primary and kindergarten students. We also have the priority booking hotline. As of 1 p.m. yesterday, as the 23 designated clinics, we have provided consultation for more than 118,600 patients, including 16,600 patients who got a booking via the priority by the care booking hotline. So we don't have a separate figure for children only. Sorry, speaker is not speaking through the mic. The QR code was only launched yesterday. For patients who are yet to get a QR code, do try again later. For patients who already have a quarantine or isolation order, they should be recorded as a confirmed patient on our system. If they don't get a QR code later, please call. They should call our hotline to see whether there is a data mistake.
Lady over there, please.
好，你好，点新闻记者。
Dot News.
昨天呢，开始在全港680个服务
Yesterday,
发快测包，但是由于各个站点的
at 680 points, the government distributed the RAT kits, but they were not anywhere near enough. People were running around to collect these kits. Some went to the elderly centres for the kits, but they were restricted to the elderly population. The whole arrangement seemed to be a little bit chaotic. How will the government be improving the management? Earlier, the government made the announcement that for those aged 60 or above, the IAs would be made available at designated points. The whole idea is to facilitate the senior citizens and to make available the supplies and to make sure that they would find it easier to get hold of these kits. To undergo testing and also to identify the potential cases. Now, these are facilitating measures at different places, at the DHC, district health centres, or DHC expresses, or the elderly care centres, and also the elderly services centres, 14 of them under the DH. They are available at these places. And the FHB will be reviewing the situation and take follow-up action. Next, please. Lady on the far left, please. Mingpao Daily. Dr. Ao, your hotline and emails, how many patients have called in or written in with the inquiries? Now, sometimes you cannot find a record because the system is being updated, and some were infected in February. They've been issued the isolation order, but the record wasn't there. But the record was in e-health system. Why is it that this situation would arise? Is it the case that there are different paces of updating in the different systems? If people were confirmed less than 14 days ago, would they be able to get the recovery record QR code? Some said that if they input the QR code into the Leave Safe app, they would still show the red-framed QR code, and they cannot get entrance to the eateries. Now, for the 4 people who reported positive from the schools, were they at school yesterday, or were they infected at school yesterday? And if that's the case, has there been any chances of transmission? Is it worth further investigation? And also for the day 12 positive case, have you got any updates regarding the genome sequencing and RAT numbers? How many of them tested PCR negative and for the first time and the second time? And after they tested RAT positive, how many cases have been referred to the police? Thank you very much for your question. First of all, about the recovery record QR code. Since the launch of our platform for the RAT positive cases, we have provided an email address for those who failed to make the declaration to write in with their inquiries. It may have been the technical difficulties, they failed to receive the SMS, or they failed to make the declaration on time. Since March the 7th, the email address has been active. We have received hundreds of thousands of inquiries. We are getting to them as time goes by. And if they can produce credible reasons, we will send update the record. In the computer system, we would update the confirmed cases. Once the system has been updated, then it will be available. The information will be available across the different systems like the e-health and the vaccination record system. The updating is ongoing. If there are new cases coming in, we would be incorporating them into the system. For the recently infected patients, they would also be getting the recovery record QR code, but this QR code would be valid for 180 days, starting from the day of infection. So in our isolation order that we issued yesterday, they are accompanied by the recovery record QR code. Now your question is, in the Leave Home Safe app, once they've downloaded the QR code, it will turn red. And I mean, I'm not sure about this. Maybe there's some technical issue. If they successfully download the system, they would be able to get it. The hotline was activated only yesterday. We have received well over 100 inquiries as of last night. There are more coming in today. We will get to them as soon as possible. I don't have the precise number with me for the time being. The third question about the schools. Today, there are 4 cases involving 3 schools. These students didn't turn up at school before they tested positive. There are 2 that are back to school today, and we have the requirement for the students and the teachers to undergo IAT test. And they tested positive through this procedure, and we're trying to stop the positive cases getting into schools. Now, the other question is about the day 12 positive imported case. We have a number of these cases in the past couple of days. We got hold of the specimen from the laboratory. The genome sequencing is going on. I don't have the information for the time being. As to the RAT positive and also the spot check this is an ongoing exercise each day. For those RAT COVID positive cases declared on our system, we would spot check them up to a certain percentage. We have covered 33,000 specimens so far, and 5% of them turn out to be negative. Now, these are for several reasons. Some made the declaration late, and these were earlier cases, and they have already recovered. Some made a wrong declaration, and they tested negative, and they still made the declaration. We conducted investigation. If there are fake positive, we would delete the record and also the isolation order. Speaking out, speaking through. For the other school, it was the first day back yesterday. The relevant student didn't go to school. Lady at the back. Orange News. The number of positive cases has rebounded a little bit, and the social distancing curbs will be relaxed tomorrow. Are you worried that it would cause a rebound? And what level of the rebound would you consider reintroducing the restrictive measures? There are more students testing positive. Do you think that this is in line with the government's expectation? What proportion of the positive cases in school would you consider suspension? And the COVID is easing. Would you reconverting the designated clinics into regular ones? And what about antiviral oral pills? How many have been prescribed, and any adverse effects?
Thank you for your questions. On the situation of the epidemic, The number of cases we see today has risen mildly compared with yesterday. However, there's usually a fluctuation within 100 cases. We can't take out the number of one day to assert that there is an upsurge. At present, the situation is still stable. We have recorded 600 to 700 cases for the past few days. Surely we don't want to see a rebound. Still, we are just past the Easter holidays with a lot of gatherings. So we will keep closely monitoring whether there is a rebound. The government is going to relax the social distancing measures, but I remind the public, despite reopening of premises and relaxation of social distancing measures, when you visit these premises and when you go out, please comply strictly with infection prevention measures, including a face mask, hand hygiene, and avoid contacts with non-household members. If you have contacts with high-risk people, you should do a test. Of course, we want to return to normal life as soon as possible. We will keep monitoring the different indicators, including daily and infection numbers, sewage samples, as well as the positive rates at the community testing centers to see whether there is a rebound. To what level should we tighten the social distancing measures again? Well, we don't have we haven't set a threshold, so we will just keep monitoring it. We are requiring students to do a RAT before they go to school each day. This is a risk control measure to avoid outbreak at schools. When cases are reported, we will look at the number and distribution of cases in schools. When extraordinary pattern is found, we will carry out investigation. For example, if there is a consistent increase of positive cases daily and also clustering of cases in classes, then we will do an investigation. In terms of a percentage which would invoke suspension of schools, but we don't have a set of we haven't set a threshold. It depends on the situation of each school. For oral medication, as yesterday, public hospitals had prescribed more than 27,200 treatment courses. The patients responded positively, and there were only mild side effects. This is part of our efforts to support patients in the community and also offered layered and treatments and help for patients. Now, schools have just resumed in-person classes. We will keep monitoring the situation and adjust our service level. Next question, the lady in the front. Good afternoon. I'm from Hong Kong Economic Times. The 12 students yesterday, you said it was a mistake made by parents. So have they conducted another PCR test to confirm that they are safe, and are they at school today? In terms of reporting positive results afterwards, you said you have received 100,000 applications. So how long will it take for you to confirm their status? Now, the 57-year-old female who passed away, when was she admitted to hospital, and did she die with or die of COVID? And what about the deceased patients who has received the 3 doses? Now, the hotline for recovered patients, how many people are manning the hotline, and does it operate around the clock? And you said you would deploy more manpower to help. So how many more people will be deployed? So you said one of the possible reasons is that erroneous information was submitted from community testing center. So how would you rectify the mistake? Thank you for your question. Yesterday, a school reported 12 students tested positive via RAT. We made an inquiry with the school immediately. The school told us that 12 students were tested positive. So we asked the classes. We asked for the classes and investigate the distribution. So 10 students were from the primary section, 2 from the secondary section of the school. So we are trying to get a complete list of information of these students. Despite the fact that they weren't at school before the test, we still want to investigate more. Hence, we asked for a complete list of the information. And then the school asked the parents again, and it was confirmed that the parents made an erroneous report via the school's intranet, and then the school reported the cases to us. So we are trying to figure out with the school why this mistake was made. Was it really because of the mistake made by the parents, or were the students truly infected? So these 12 students have attended school today. Another RAT was performed for them at school, and they came back negative. So we have already secured a list of the 12 students' information. Concerning out-of-time reporting, we encourage patients who have tested positive by RAT to make a declaration to us as soon as possible, so that we can issue a quarantine order to them and arrange for them to admit into isolation facility if needed. Late declaration would undermine our assessment as well as infection prevention work. Some patients might have forgotten to make a declaration, or maybe they are too unwell to file a report, or there is no one around to help them. That's why we have a mechanism for them to make a report via email. We want to prevent false reporting or misuse of our system. That's why we would look at each and every case and assess the reason. The operating hours of the hotline is 9 a.m. to 9 p.m. We would keep closely monitoring the usage of the hotline, and we would increase, we would deploy more colleagues to man the hotline if needed. For recovered patients who have yet to receive a QR code, one reason might be submitting the wrong ID number. When the RAT test was conducted, maybe the patient submitted their passport number instead of the ID card number. That's why we cannot match the patients with the data on our system. For these cases, the patient should approach us. We would verify the telephone number and other personal details of the patient. If confirmed, we would update the system accordingly.
Yes, the answer is yes. although I don't have the number with me. About the deceased 57-year-old female, she suffered from cancer at the terminal stage on April 6th. She suffered from choking, and from the nasal swab, we picked up a positive case. The CT value was 35.5, and April 7th, also 35 positive, and the next day she turned negative and she was discharged on April 12th. She had a follow-up consultation. Her condition was weakness. She had to be wheelchair bound. We discussed with her family members, and they also would like to have palliative care. And on April 17th, her condition deteriorated, and she was admitted to hospital for shortness of breath. And on April 19th, she sadly passed away. The expert committee would review these cases to ascertain whether they are related to COVID, that the patient was a terminal cancer patient. And there was another patient who had 3 doses of vaccine, and that's an 84-year-old female. She has some underlying conditions, stroke, coronary heart disease, and hyperlipidemia, and she's also a high-risk person. Let's make it the last question. AM 730. About the recovery QR code, some patients didn't make the declaration. Under the law, declaration must be made. Now, some residents may be worried about breaching the law and would be reluctant to declare the cases. They make the declaration retrospectively, and they want to have the QR code. Would this be acceptable? And it is said that the QR code would count day 15 from the infection, and the quarantine period would be 7 days. Would they still be able to use the QR code? And for the students, how many are local school students? How many are from the international schools? And what is the ratio in terms of the teacher and student? And would it be consistent with the general scheme of things? And private practitioners can prescribe the antivirals. How many drugs have been made available to the private practitioners? Now, you said that 6,000 or so people have been taken off the list, and how much would that help in terms of resources? Thank you very much for your question. On the first question about the recovery record QR code, now if someone is a recovered patient, then the QR code would be valid for 180 days, and the recovered patients should, in accordance with the recommendation of the scientific committee, get vaccinated. We do have the timetable for them. If they get the QR code after recovery, they should, depending on their condition, get the jab, so that when the second and third phases of vaccine pass comes into being, the QR code will still be valid. Now, for those who are not sure whether they were infected, or if they were infected and didn't make the declaration, according to the scientific committee's recommendation, if they are not sure whether they were ever infected, or if we don't have their recovery record in our system, then it is recommended that they should fulfill the vaccination requirement as if they were never infected, and it would be safe for them to do so. And they should have regard to the scientific committee's recommendation, and they should have the next jab at 28 days after infection. As to schools, there are 4 schools involved today. They're all primary schools because it's only the international schools and the primary schools that are resuming in-person classes. Now, for the COVID positive cases, the number is well within our expectation. We have about 600 caseload per day, some of them involving young children. The numbers submitted by the schools is also well within our expectation. We require the parents to IAT test their children every day in order to curb the spread on the school campus. Now, for the private practitioners, Dr. Ho might have the information. Yes, for private practitioners, they have submitted the information that 7 patients have been prescribed the antivirals. As we said, we changed the methodology for statistics. That's in order to reflect the actual situation. Now, there are patients who have already recovered and will not carry any risk. They remain in hospital because of their own conditions. Some of them are non-COVID related. There are some psychiatric patients who have to remain in hospital for further treatment. Their COVID problem has been sorted out, but for some reason they still remain in hospitals. If we include these recovered patients into the statistics, then it would not be inaccurate in our assessment of the pandemic. That these patients are still hospitalized for medical attention. In our medical ward, utilization remains high in Pok Hoi Hospital, PWH, PMH. The utilization rate is particularly high, and the hospitals are still under quite a lot of pressure. We are trying to reflect the situation as it is. Not speaking through. They are recovered patients. In our isolation order, we have already accompanied the QR code. So once they are done with the quarantine, they can use the QR code. That's it for the press conference. Thank you all very much.